Hello everyone, I am Dr. Rukmani Choudhary and you are watching Dr. Rukmani's Health Update. My today's topic is sleep apnea. So this is a serious sleep disorder. I'll be talking about everything like what is this condition and who are at a higher risk, and the diagnosis part, required test, best test, or we can say and best effective homeopathic medicine and allopathic like devices, appliances. To watch complete video for complete information. So let's begin. Sleep apnea. So apnea is a term that is used for like stoppage of breathing, means there is no breathing, right? So this is apnea, and the sleep apnea means there's a breathing problem. Your breathing stops and start while you slumber. So this is a kind of serious sleeping disorder. You have like your breathing stops and starts. So this way, this is a serious sleeping disorder. Now, like what are the risk factors and who are at a higher risk and why this condition developed? Sometimes it is not diagnosed, it is mistakenly taken as snoring or some, but by collecting all the symptoms, yes, we can have a right approach towards this. So like there are risk factors, overweight. So if you are overweight, this means you are at a higher risk. And being male are more prone to have this problem. And if someone had like sleep apnea or having sleep apnea in your family, so yes, there are chances, means yes, the cases are seen in family history. And some hormonal problem like PCOD, PCOS syndrome, like high lifestyle disorder like high blood pressure or diabetes, these conditions develop sleep apnea, and they also like develop after sleep apnea, means they act as a risk factors and even they act as a complication. Types of the sleep apnea. See, sleep apnea, like there are three basic categories. Number one, obstructive. Commonest one, the common one, obstructive sleep apnea. This is found usually, and this is the common one. Obstructions means there is a blockage, there is a choking in your respiratory passage due to anything, like you can have adenoids, tonsils, or any soft tissue growth can be there, and this can cause like obstruction, and you have obstructive sleep apnea. It comes like central sleep apnea. Central means there is no as such blockage or any obstruction, but there is a problem, there is an issue in your brain. In brain there are areas for every system, like for hearing, for speech, and obviously for breathing also. So there are some issues, there are some problem in that affected area. So there is no proper signal for breathing, and there is no proper contraction. So there is a breathing, so there are issues with breathing. So this is called central, because this is related with your brain, central nervous system. The third one is the complex one. In the complex one, you have the problem are there. You are having obstructive sleep apnea as well as you are having central sleep apnea. The symptom completely depends the case history, like whether this is a mild case, moderate one, or serious or critical one. Always depend, but the basic symptoms are you have snoring, and that is prominent snoring, means you are having prominent snoring, and you are having insomnia, means there is a sleep disturbances. Why? Because you are having breathing problems. So you wake up, and yes, there is a exact timing of waking up. So you have exact timing, and there is a urination problem, there is anxiety, depression, restlessness is there, and cause you are not sleeping properly, so you have sleepiness during daytime, drowsiness, dizziness is there. Diagnosis part. See, diagnosis is always made by collecting all your symptoms, like what all symptom you are having, and certain tests are done. So diagnosis is made by taking your medical history, that what all you have taken. You taken any kind of drugs, opioids earlier in your past, or are you having any family member who's having the sleep apnea? So everything is considered and all the symptoms are noted down. The complete history should be made, and like physical examination, are you having like any tonsils or adenoids? These should be considered, approaching the final diagnosis. Now the test part. There is a test that is called PSG, somnogram. This is a kind of sleep study that is done like while you sleep. Your brain activity, your breathing activities, everything should consider like while you sleep. Activities are, they are. So this is is a very helpful test, and there are other advanced tests also. Complication part. See, this is a serious sleep disorder, and once you know you have symptoms, so just try to get it treated as early as possible. See your doctor right away. Otherwise, there are complications like you may have diabetes, and there is a metabolic disorder. You have high blood pressure. These are certain complication. Like treatment part, is there any treatment available for sleep apnea, or what type of treatment do we have for sleep apnea? Sleep apnea, according to case, that whether it is a mild case, moderate one, or serious one. For mild cases, we have medicine for milder cases, and there are some lifestyle changes, and treatment always should be focused that what is your individual case. Are you having any kind of nasal allergies? Have you had like any kind of drugs, or does it runs in your family? You have family history, you have any allergies, or is it like obstructive type, or is it like central type? There are some issues in brain. Everything should be considered for the right approach, making right approach for the treatment part. Obviously, the cause is considered, individual case is considered, right? And in advanced cases, critical cases, for serious cases, there are some devices, like one is like CPAP devices. Like but these cases have less like oxygen in their blood, so for that purpose there is a continuous air pressure is given. That is, the device is called CPAP. And there are advanced devices nowadays like auto CPAPs that regulates air pressure automatically. And there are some oral appliances. So according to the case history, case severity, there are devices, appliances. Homeopathy, how homeopathy can help you using homeopathy medicine. First of all, you have to like study about the medicine and your case. You have to consider each and every symptom of yours and just try to match with the medicine. This is homeopathy, like your symptom and medicine symptom, then matching of both the parts, individual approach. So of course, the each and every individual is different, and we have to focus on the individual. Whether are you obese, or you having any medical history, like are you allergic, is there any nasal allergies, blockage, or anything, like we have to consider as a whole. And then use one medicine at a time, don't buy. It's a humble request. Patients are buying all the then they are consulting. No point of consulting. If you want to consult, just consult before buying medicine, or just watch the video patiently and just understand the video and then buy the medicine accordingly. If you're watching on YouTube, I have provided all medicines link in the description box. But these are not the limited medicine. There are other medicine. Of course, there are countless medicine in homeopathy for each and every problem. These are not the limited medicine. Lakashna in homeopathy is very good medicine for all sleep apnea cases, particularly for obstructive sleep apnea. So you have like a breathing problem during night aggravation, and you suddenly wake up and you have asked for breathing. So for that you can use Lakashna, and this is in the liquid form. You just focus on medicine name, the form, and the color, can be anything. Just buy the authentic one and just focus on the medicine name. Lakashna is 30 or 200 potency, and just use with the dropper, 1 or 2 drops direct on tongue orally, and just have it like once or twice in a day, and for 2 or 3 days or 2 or 3 weeks, depending on your improvement part. Ammonium carb we usually prescribe in cases like when you have adenoid, when you have tonsils. So for the obstruction purpose, we use ammonium carb. So you can have ammonium carb if you are having all these things. Use this medicine with the help of dropper, 1 or 2 drops direct on tongue orally. Same way, like 2, 3, 4 weeks. Opium is given when you have profound or like prominent snoring. So in that case, opium works amazing. So you can have opium, but again, one medicine at a time depending on your symptom, that what symptom you are having. The next comes Sambucas Nigra. Sambucas is given in children cases and kids cases. When they have sleep apnea, we usually prescribe Sambucas Nigra. There are other medicine like there is Lamna Minor that is given when you have nasal polyp, and due to that you have sleep apnea. Grandelia mother tincture. Grandelia for the asthmatic purpose, like you having breathing issues, you are having asthma. In that case, we prescribe Grandelia mother tincture Q form. Just have 5 or 10 drops in some water and just use it. Hopefully this video can help you. If you find this video knowledgeable, informative, please like and share. Subscribe my channel, press the bell icon to get notified. Keep watching, keep supporting. Thank you for watching. Thank you so much.